Hello, everybody. We are on air with this wonderful talk. So we have three marvelous speakers from Ohio State University talking about One Health. This panel discussion will also have the participation of Professor Miliani. The first speaker is Dr. Gebreyes. He's a professor at the Department of Veterinary Medicine in Ohio State University, executive director of Global One Health Initiative, and has expertise in the area of global health and infectious zoonotic diseases. And he directs the One Health Ethiopia project. The second speaker is Dr. Wang. She's a medical director in Bang Frankly tuberculosis program at Columbus Public Health Department. She's a professor and director of research and implementation science, capacity, and community health at Ohio State University. And she's currently involved in several international global One Health and tuberculosis projects. Thank you very much for accepting our invitation. You can share your screen now.
Okay, can you see my screen? Can you hear me okay?
Yeah, we can hear you and we can see your screen.
Excellent. Thank you so much. Muito obrigado for inviting us. Bom dia, everyone, all Brasileiros listening to this conference. I heard it's been really a great conference going on. The last 3 days, it looks like. Okay, thank you for the introduction, Patricia, as well. I'm going to give you an overview of Global One Health Initiative, particularly focusing on Ohio State's work and how, giving you the background and how we were established as a Global One Health Initiative, and give you some examples of projects that we do from Latin America, including Brazil, as well as from Africa. So just quickly to give you the whole landscape of global problems that we have, many of which you already know. The graph you see on the right-hand side is from the Global Risk Forum, World Economic Forum 2020, identified a number of priority areas. The top three are climate change, pandemics/infectious diseases, financial crisis, and many other problems that the world is facing. Of course, now with the COVID-19, we are already facing the top three already, right? With the pandemics, we are in the middle of a pandemics that we never thought there would be a major global financial crisis we are in, and so on and so forth. So these being the major ones, of course, One Health fits into many dimensions. If you look at food safety or food crisis, or waterborne diseases and water security, pandemic or infectious diseases, and so on and so forth. Of course, the problems that we are facing in the world today are very complex, and we live in interdependent world, particularly because of many reasons. One is the population, the human population in the world currently are 7.6 billion. We are expected to pass perhaps 10 billion by 2050. So every day, more than 200,000 people added to this planet. If you think of sub-Saharan Africa, SSA, just itself is 1.2 billion now. It's expected to pass well beyond 2 billion by 2050, or close to 2 billion. So these complex issues, health is one of aspects, but many other issues are the world is facing more and more challenging times. So we all need to be aware and on top of it. So with this interconnected and interdependent world, one of the key parts that we health professionals, including veterinarians, play is about 75% of emerging infectious diseases in the world today are of animal origin. Human health, animal health, and the environment are highly interconnected. That's what One Health addresses. So if you look at the one on the right-hand side, emerging zoonotic diseases on this slide, you see disease outbreaks that originate first, amplify in animals before it becomes really a major human health outbreak. Or it could be on insects, others. You know, being in Brazil, many of you, just the most recent example could be a Zika virus, insect-borne, right? Or Ebola from sub-Saharan Africa. Or of course now with COVID-19, that is coronavirus that circulated in wild animals in Asia before it became a pandemic. So there are so many examples like this that necessitates a One Health dimension. Again, human health being the ultimate outcome, but at the interface of animal health and the environment. The environment also, of course, includes the plant health. Often we tend to forget plant health in the One Health dimension. But what you see on this slide on the left-hand side is from the National Academy of Sciences, the United States National Academy of Sciences. There is a major global trade now, as you know, globalization. Brazil is a major exporter of many of meat products and soy, others to the United States. And if you think of a bowl of salad in the United States, the ingredients can originate from more than 30 countries around the world. So again, we live in a highly interconnected world. What you see on the right-hand side is one of the examples of a major global public health crisis that touches veterinary medicine, human medicine, and the environment is antimicrobial resistance. A recent study done by a think tank in the United Kingdom showed that by 2050, there will be 10 million human deaths per year because of antimicrobial resistance, and disproportionately high in Africa and Asia in general, but of course Latin America and all around the world. So, you know, all this culminates into the United Nations Sustainable Development Goals that has 17 of this SDG agenda that we hope the world need to take care of by 2030, many of which fits into the One Health dimension, whether it's hunger and food safety. Of course, agenda number 3, global health and well-being, is the central focus of One Health as well. So, you know, of course, in the US, as Ohio State being a US academic system, as many of you know, Brazilian academic system also has program on internationalization now, the PRINT program, previously Science Without Borders. We have an obligation to really address these sustainable development goals. We feel it's that way. At the same time, we're trying to understand where is the best place a university initiative can fit in many of these sustainable development goals, of course. And also partnerships, strengthening partnerships with across the world is critical to have a mutually beneficial capacity building. How do we train our students, Ohio State, while we cross-train Brazilian students and others? Currently, this is a US data. We have a very large mobility, academic mobility between China, India to the United States or European countries. Much less so in Latin American, particularly South America, but also much less so in Sub-Saharan Africa. But just let's put this aside for now. So our Global One Health initiative, we call it Go High. We have our vision of building this capacity for Ohio State, for the United States, but also for our strategic partner countries. And Brazil happens to be one of our key strategic partners. We have been partnering since about 2007. We started with Paraíba, Federal University of Paraíba, later on within Pernambuco, around Pernambuco, and Univasf, San Francisco Valley. We have partnership with Sao Paulo, Rio Grande do Sul, Paraná, more recently, more and more with Paraná, and we're looking forward to expand this partnership. The 3 focus areas of our strategy are training capacity, on applied research and implementation capacity, and outreach and extension capacity. And my colleagues, Dr. Wang and Dr. Balada, will address some of the key things we do in these aspects, addressing in an integrated way the research implementation science using clinical examples and training and other community engagements that we are doing. We have a highly multidisciplinary team because One Health necessitates highly multidisciplinary team. I am a veterinarian, but I myself, by being a veterinarian or the College of Veterinary Medicine, cannot by itself address One Health. It has to be a teamwork. That's why we have physician scientists such as Dr. Wang, Dr. Balada, we have public health, we have many other health science disciplines, environment, agriculture, business, engineering, and so on and so forth. So we have a large multidisciplinary team. We also, because we really strengthened partnership in various parts of the world, particularly we have many projects in Sub-Saharan Africa, we established Ohio State Global One Health affiliated entity, like a non-governmental organization that's based in Addis Ababa, Ethiopia, but working in Eastern and Southern Africa. So to give you some examples of our capacity building, which is, that is a key part, as I mentioned, in a mutually beneficial way, addressing current issues, future issues, and how do we sustain it? That is a critical challenge that we all have, not just Ohio State, but Brazilian institutes and all of us working in various health science disciplines. One of the things we do is a One Health Summer Institute. That's one of our flagship activity that we work as a summer institute, a large number of courses with East Africa, but regularly, annually, we have been doing various workshops with Brazilian institutes, often hosted in João Pessoa in Paraíba, but many of the trainees come from all across Brazil. In molecular epidemiology, something we started with Professor Celso Oliveira in Paraíba, Federal University of Paraíba, but many of the trainees come from various disciplines, multidisciplinary. We expanded in various areas, focusing on grassroots problems such as antibiotic resistance. In our East Africa program, we trained more than 1,760 trainees since 2012, and many professors. If you take example of 2019, about 40 Ohio State University professors traveled to East Africa and participated in these summer institutes. So we'll happy to discuss later on during the panel discussion. One of the global major concern is a global health security agenda. You can read about it more in detail on the website. It's a global agenda focusing on 11 issues, and most of it deals with One Health issues as the interface of human health, animal health, the environment. So we have a cooperative agreement with the US CDC, Center for Disease Control and Prevention, working on grassroots problems such as zoonotic diseases, rabies and brucellosis, and also antimicrobial resistance. At the same time, establishing a system, what we call meta leadership. Most countries have silo systems of their organizations. I think in Brazil, let's say Anvisa and MAPA, and the various organizations are working on their own. But how do you create working relationship? Because One Health necessitates this effective working relationship across the organizations. That's one of the things we do as well. So to give you some examples, one of the implementation science applied research we do in Latin America is antimicrobial use, antimicrobial stewardship, and resistance. We have had a number of trainees that come from Central America and South America, a little bit listed on this table, from 14 Caribbean countries. We hosted, in fact, in the first year, we hosted 33 participants, more than that, but now the countries are developing antimicrobial resistance strategic plan. This has expanded, and Dr. Armando Hoyt is the lead from our side, which now includes Brazil, Chile, and I think Argentina is also part of it, but definitely Brazil and Chile is part of this project. Another one, really a global innovation initiative. This is more of a scientific mobility. It was a grant we received from the US State Department, a flagship project among United States, Ohio State, UK, University of Liverpool, and Brazil, mainly Federal University of Paraíba. On this project, we involved 9 early career scholars and graduate students, and our focus was strengthening One Health's research and training capacity in Brazil using antimicrobial resistance as a model. It's been one of the great successful projects, and you see on the right-hand side, the middle person is Professor Celso Oliveira at the State Department meeting as we wrapped up this project. This project also led into a more strengthening partnership across Brazil. I don't know if any of you know the IMPRA consortium. It is led by UFRGS, Rio Grande do Sul, by Dr. Alfonso Bars. Another one we do with Mexico, for example, is focusing on genomics of multi-drug resistant salmonella. I'm giving you the example in Mexico on this, but genomics of multi-drug resistant salmonella that we do also includes multiple countries, including Brazil. This particular one is partnership with UNAM, the Autonomous University of Mexico. It started from the US Department of Agriculture, Foreign Agriculture Service, FAS, was original project because, again, there is a food trade between Mexico and the United States. Our goal was building capacity of molecular epidemiology, and in fact, that capacity building evolved into genomic comparative study, large-scale Mexico national study looking at beef and human isolates, looking at spatial comparison across the different cities in Mexico, like Mexico City, Guadalajara, and many others. And we looked at, besides spatial comparison, in fact, it got into geomapping and temporal analysis and various things. So on the right-hand side, without getting into the detail, it shows you the different genomic clusters of multi-drug resistant salmonella. And this project is led by Professor Enrique Delgado Suarez, who was formerly my PhD student. Research capacity building, I'll give you some examples that can be applied globally, but using example in Eastern Africa. We have a program grant. In fact, Dr. Wang is co-PI with me, is NIH Fogarty International Center. That program started in 2010 and it's still active through 2023. It includes 3 countries in Africa: Ethiopia, Kenya, Tanzania. We focus on transboundary regional issues, looking at vector-borne, foodborne, and waterborne diseases, building capacity, research and training capacity. So far, about 11 PhDs graduated. We have 9 PhD fellows on progress. By the way, through this and other programs, now we are also linking South-South, East Africa and Brazil partnership. I don't have a slide today, but Professor Rafael Vieira from Federal University of Paraná, formerly at Paraíba, is now hosting like a Somalian in East Africa student on vector-borne diseases in Curitiba. And research implementation science, I hope Professor Wang will touch on this a little bit. We did a study on tuberculosis and interaction with HIV, but also looking at developing diagnostic systems, rapid, you can call it in human health point of care, or in veterinary medicine, field deployable for animal farms for tuberculosis and multi-drug resistant tuberculosis. One of the projects that involved HIV as well was funded by the US Agency for International Development. That has been completed already. Another just example project, and very important One Health project, is dealing with Campylobacter. Not many studies done on Campylobacter. It's a microaerophilic organism, very important foodborne bacteria. Many of the food animals carry it, particularly chicken, but also pigs and others. If you go to the southern part of Brazil, the Suinos avinos embrapa is very big, but very limited studies on Campylobacter I am aware of in Brazil and other parts of the world. Most studies are limited to Europe and US. It's a very difficult organism to grow, a microaerophilic organism and a thermophilic organism, but it's very important public health issue. It is hypothesized to cause childhood stunting through enteric dysfunction, because especially children in Africa play with chicken, very common in a backyard chicken. Chicken are important reservoirs. So we're doing one study on Campylobacter genomics and enteric dysfunction in short caged, and looking at the water, sanitation, hygiene, metagenomics aspects, and so on. So without getting much into details. And food safety, we have quite a few projects on food safety in extended version. One project we have been working in partnership with Ethiopian but World Bank funded project is on Center for Drug Discovery and Therapeutics. This is a project that we have always discussed to establish a similar partnership in Brazil, because this is a very important area. Drug discovery is a big important area, as we said earlier, such as antimicrobial resistance are very challenging. Brazil is very rich in its biodiversity, and you know it very well, with the Caatinga biome and with so many and very much a rich country. So we really think that a very innovative alternative to antibiotics in veterinary medicine, in public health, in human medicine, others can be done in Brazil. I know lots of wonderful universities in Brazil are already working on this, but we, as part of the One Health, looking at veterinary, human, environment, this is one area we are interested in strengthening as we do in Africa. This is just a global network I want to mention, 1,000 Salmonella genomes, which includes Brazil, from various states in Brazil, but Ethiopia, Kenya, Mexico. This is really connecting, and United States, Mexico, Thailand, Tanzania, and also United States. This is consortium we have with US Food and Drug Administration, FDA, and we hosted a workshop a couple of, I think 2 years ago together in Brazil on this issue. We are now expanding into multiple pathogens, Campylobacter genomics. E. coli can be done with this if you have partnership and isolates E. coli in Brazilian partners from animals or food environment. In fact, this morning we were discussing with the same genome tracker group, myself and Professor Wang, we're expanding for the first time into Staphylococcus as well. So these are some examples. I don't want to take too much of your time. Just one I want to mention is outreach capacity. Community engagement is very important for us in our global One Health. Almost every year since 2007, we've been doing one or more workshop. Maybe we didn't do in the last almost a year with Brazil, but one of our flagship international congress on pathogens, human-animal interface. I hope some of you in this conference participated. In 2013, we had a wonderful one hosted by Brazil in Porto de Galinhas. You know it, beautiful area in Pernambuco. So yeah, I wish COVID is over and we meet in Porto de Galinhas. Okay, with that, I will finish, and I look forward to discussing further, but I really want to emphasize and thank many of the Brazilian organizations, CNPq, for many different, including the conference and some other joint projects we did, PhDs we hosted, CAPAS, of course, Sprint is funded by CAPAS. We had a Brazilian Ministry of Science, others, FACEP, FAPESP, you know. So we have had a great partnership with Brazilian state or federal agencies. So I will stop here and look forward to discuss. Thank you. I will stop sharing soon.
Great. Thank you, Dr. Gebreyes. I will go on to mine. Whoop. Sorry. Oh, hold on. Is it on the slide?
Yes, we can.
Yes.
Perfect. Thank you. So as Dr. Gebreyes gave an overall approach to our Global One Health at OSU and our interconnectedness with other collaborators around the world, including Brazil, the next section for me and Dr. Balada, who will be following me, is that kind of using bovine tuberculosis as kind of like a platform of showing One Health, and then Dr. Balada will be talking about the test. So the objective of the talk for me is really talk about global tuberculosis epidemiology, talk about zoonotic TB, as well as some new tools that we're using, genotyping, geocoding, and social network analysis. So as Dr. Gebreyes was talking, the sustainable development goals are so important in terms of where we're projecting, and tuberculosis is actually one of the targets, 3.3. So by the year 2030, the end of the epidemic for AIDS, TB, malaria, neglected tropical disease, and to combat hepatitis, waterborne disease, and other communicable diseases. So it's a very large challenge. We're not approaching there yet, but certainly we want to be heading in that direction. So every year, the World Health Organization puts out a human tuberculosis global report. So then the 2021 just came out reporting on 2019 disease. So we had 1.4 million deaths due to tuberculosis in 2019, including 208,000 amongst HIV infected individuals. It is the leading killer among HIV infected individuals. In fact, it's the leading infectious disease killer global, and it causes majority of antimicrobial resistance deaths could also be due to this. But in addition to the TB deaths, there was 10 million people who were actually affected and became ill with tuberculosis, including 1.2 million children. I guess the good news is that with improved diagnostics, we're seeing increased reporting and decrease in the number of cases, but we are nowhere near achieving our goal yet. And then in terms of the mortality, we are decreasing in all of the individuals. So they have this triad of tuberculosis, multi-drug resistant TB, and TB HIV. And you can see Brazil is actually at the intersect between TB and TB HIV. It's one of the high incidence country for that. But Ethiopia, the other country we work in, is TB, multi-drug resistant TB, as well as TB HIV. So if we look at the Brazil data, we could see that in 2019, you had more than 96,000 cases at an incident rate of 46 per 100,000, including 1.2 per 100,000 in terms of multi-drug resistance. But then again, the rates are going down, so that's good. More than 87% were pulmonary or TB of the lung, which we think about being infectious. And then there is also increase in terms of the age group, the young, you can see, and mostly male. But again, the TB mortality is coming down. But when we talk about tuberculosis and how to combat the challenge, we have to think about two major areas. One is latent TB infection, and the other is zoonotic TB. So in terms of latent TB infection, so these are the individuals who have been exposed, infected, but are not having active disease symptoms. But the fear is that at some point, about 10% or more of these individuals will go on to develop active TB disease. So then they will be at the top of the iceberg, so the 10 million people with disease. So this is about 1/4 of the world population, so a lot. And then in terms of TB elimination, we have to think about this. So again, the other sector is, what about bovine tuberculosis? It is contributing to the entire TB pool in terms of One Health, definitely a large human component, but we don't know what that component is. And the reason being is that we don't have good surveillance data. So in developed countries, they have surveillance data. It's actually quite economically expensive in terms of if you identify cattle with tuberculosis, the government actually has to indemnify and pay the cattle owners money to take the cattle and then cull it. But in many countries, such as Ethiopia, we don't have that capacity. So we're not doing surveillance. We're not doing control. So the World Health Organization estimates that maybe 10 to 15% of the human TB cases could be accounted for by zoonotic TB, which accounts for about 150,000 or 12,500 deaths. And without improvement in this sector, we're not going to be able to eliminate TB. So again, you could see where the large areas of zoonotic TB could be within Africa, Southeast Asia, not so much in the Americas. So a few years ago, the World Health Organization, World Organization for Animal Health, as well as the Food Agriculture Organization and the Human Tuberculosis Union put together this roadmap. And the URL is here. And it's excellent in terms of kind of bringing the problem to the forefront, as well as some of the solutions. So again, this just estimates the disease burden, and again, not so much in the Americas as compared to other global efforts. So where are we in terms of breaking this chain of transmission? So we could see that in terms of if we have a cow with TB, we can certainly be consuming unpasteurized milk or eating raw uncooked meat, and the human would get ill. Then the cow would actually contribute to the environment where he's shedding, sharing same food source with potentially a vector such as a reservoir such as a deer. This is a problem that we're seeing in Michigan in the United States, and I will go over that. And then from the deer to the human, you could have hunters, you can have other people who are in close association, and then they would be getting that. So when we think about public health and the traditional epidemiology, we think in terms of tuberculosis, we have the epidemiological link or risk factor. So if I have TB, I'm coughing, my husband gets TB, he probably got it from me. So we have, the same geographic link, we have the same social network, but it's really with genotyping, I believe that we can kind of put all this together. So if there's the same fingerprint pattern, then you know that one person transmitted to the other, and we can kind of link and expand public health to improve diagnosis. So again, we feel that about 10% of the cases of latent TB or exposure will at some point go on to develop active TB disease. In the US, we perform molecular genotyping on all culture-positive human cases, and we think about 13% or so or more are actually direct recent transmission. So this is a major thing for public health. Well, what about the zoonotic component, right? Because I know most of you are veterinarian with interest in that. So we definitely see human to human component, but we are seeing this animal to human. And this picture is actually not that he loves his cow and he's kissing. It's from Dr. Balay from Ethiopia, who shared this picture with us. It's that a farmer is actually chewing a certain kind of plant that gives him stimulant. And so he's tired, he's chewing, but then he wants to share it with the cow so that the cow will have some energy and continue to plow the field. So truly a very close contact. But besides direct, close, aerosolized contact, we can certainly drink unpasteurized milk or eat raw uncooked meat as a source, and also direct contact. So this is a veterinarian who had direct contact. So again, since 2004, we have been doing molecular genotyping. And I think it's a very strong tool. We used to do RFLP, and then we did 2 types of swallow and Myru, like PCR based. And since 2018, the US has transitioned to a whole genome sequencing. And by 2021, we hope to be able to do that. And again, whole genome sequencing is actually used in a lot of states, even for rapid molecular drug resistance testing. So we know right away what to treat. So not to go into a whole genome sequencing lecture, but we could see that with the whole genome sequencing, we can actually identify the close link. So if they have 0 to 5 SNP or single nucleotide difference, we know that they're within a recent transmission, so somewhere that we need to go and investigate further. But if they're more distant, then it's probably not a recent within the last couple of years. And then we can actually make these beautiful phylogenetic trees with these nodes where we can see where the diversion has occurred. So what about, bringing us back to bovine again? So I said that we do have a tuberculosis in our cattle industry. And so this is data updated from August of 2020. And this is Ohio here. For those of you who visited and others, we welcome you post-COVID. And then, but you can see that in our Upper Peninsula in Michigan, we have had several clusters of outbreak, and it's still continuing on. And more recently, we have heard of outbreak in Texas in our cattle dairy cows as well. So still, we're seeing several outbreaks, and again, at a very high economic consequence. So now I want to transition a little bit to a history and kind of bring this bovine TB case to you. So it's a 77-year-old male with history of rheumatoid arthritis. So he is on a very low dose steroid to help with his rheumatoid arthritis. So he could be a little bit immunocompromised in that sense. He lives in this northern Michigan peninsula. He denies any travel to any countries where there was TB. He doesn't know anybody with history of tuberculosis, and he has no history of consuming raw and pasteurized milk or eating raw food. But he actually was admitted to the hospital with cough, fever, night sweat, chills, and diagnosed with pulmonary tuberculosis. And when they did the genotyping, they were actually able to find that it was Mycobacterium bovis. So again, we have modern diagnostic tests that we use. We can look under the microscope for the sputum. We start patients on individual drugs right away. We work at the culture, and we have the sequence data that comes back. But you can see that the gentleman that I'm talking about is here in 2017. He's actually linked to the gray, which are deer cases, and then the cattle is in blue. So you can see this close molecular genotype association within this cluster. And he is a hunter, and I will show you more pictures, but hunting is a major sport up in the Midwest and North, where in the wintertime, people take days off. They go and camp in a tree, or they hike amongst with guns or arrows, and it's a major activity. And you can see that this gentleman actually was also, though not close, linked to other human cases back in 2012 and 2004. And we have actually 2 additional cases to add to this. One is in a taxidermist who he was cleaning the deer head, for mounting, and he has the same strain, and more recently in another individual. So again, there's been a lot of public health campaign. Don't eat deer carcass that look like this, like deer has hidden danger. I'm not going to play this, but it was a news report to trying to educate the public in terms of deer and population. So we can see that there is large amounts of cattle potentially with tuberculosis, and we have many different hosts, and for us is the deer in the US. So deer hunting, again, is a major popular sport. So in Michigan, as part of the public health endeavors, the Department of Agriculture and Rural Health actually asked the deer hunters if they would donate the head of the deer. If they're not going to use it, they're not going to mount it, if they could donate it. And then they will actually test them, look for the lymph nodes to see if there's any tuberculosis. They're also looking for other diseases as well. But as part of this, they're doing this. And so on the bottom here, these are all deer head that's been donated early morning, like every week they bring them to the thing. And so these are all laid out. And this is actually OSU visiting scholar. So Dr. Elaine, she's from Brazil, and she and our scholar from Ethiopia, Dr. Agumas, actually we went up there to inspect the nodes. So it was quite enlightening to see all these animals, quite a lot. And they were testing, and there continues to be positive Mycobacterium bovis within this group. So besides the deer hunter, the other public health effort, or the continuous effort that's going on, is the U.S. Food and Drug Administration actually goes to the slaughterhouse and does surveillance. So what they do is they randomly sample meat, and certainly anything that looks abnormal, but also those things that look normal, they will sample it. They will do these various tests, and then they will hold that meat until these tests come back and they're negative, and then they will send it out. Well, as part of this kind of testing, you can actually identify groups or backtrace to farms that have abnormal or infected herd, and then they have to go ahead and do tuberculin skin tests or do blood tests on the cattle to identify, and then they take them and then they cull them and then identify and try to do more cleaning. So again, Dr. Bellata will go into some of the testing, but it has been a major challenge in terms of that. And again, this is just to show you in Texas, they're having a major outbreak now in cattle as well. And so with molecular genotyping, you're actually able to identify strains of TB and where they are and where the close link association is. And you can see that they could come from milk or cheese or other meat specimens. So just to give a history, and some of you may have heard this, so this is kind of, again, up in the Michigan Peninsula. They were able to, in the slaughterhouse, identify and backtrace to a farm where they identified Mycobacterium bovis in the meat that was in the slaughterhouse. They went back and they traced all these other cattle. Where did the cow come from and where did the cows go to? And then they were looking at more of the spread. So back in this time frame, they found the diseased cow in the slaughterhouse in February 19th. The source was quarantined. They collected lymph nodes. They did additional herd testing and found more than 18% positive, which is pretty high. And then they had some of the cows necropsied and they found more TB. And then within this, they had more than 451 cattle. They were all tested and culled, and they had done various testing with either blood or tuberculin testing. They found, again, more than 18% positive rate. And amongst these positive, they had either gross lesions, which you can see that are very abnormal, or by pathology, or by culture, or by PCR, including in the lung. So if you identify in the lung, you can think about it being aerosolized and potentially infecting close human contacts. And then so definitely a high percentage of positive. They also tested other environmental reservoir. Again, as part of One Health, we're looking at human, animal, and the environment. So these other animals that are within the environment that were tested, they actually identified cats that have been positive. And we definitely know that in Mexico, where we were, they have dogs that roam around the dairy herds that are positive as well. So again, then going back to the human, they identified within the farm, they tested the human who were exposed to these cows. And then you could see that the yellow are people that had tested positive by the tuberculin skin test. And then they had X-ray and abdominal CT imaging done. Those were all negative, but these individuals did admit to drinking unpasteurized milk from the farm. And so again, we're trying to increase public health education, and OSU had a grant to go up there and do some education as well as collecting the samples. So we've been collecting the samples from the Michigan cattle herds that are autopsied or necropsied, and then we've been doing some of our rapid diagnostic tests. And you can see that genomically, we need both the human as well as the animal data to be combined in order to know the linkages. So I was Googling, or PubMed, like Brazil, you guys have a very rich history of Mycobacterium bovis here. And we've actually set up some collaboration. Dr. Balada and I came last year and visited in Santa Catarina with Dr. Lainey Anzai. And we've set up some collaboration for advancing Mycobacterium bovis studies. And we're hoping to launch that soon. And so again, one of our goals at the OSU Global One Health is to help develop or rapid diagnostic tests that are cheap, economical, and can be done in the field. And this is us in Mexico trying to do some of these tests. And again, kind of taking some of the tests that are used in human to see if we can use it in the animals, and vice versa. And then this is a hospital sign where these are cows that have positive tuberculin tests, and they actually get milk, but they get milked after the non-positive tuberculin cows, but they all kind of go into one vat. So it kind of defeats the purpose. And when they went to the market in these cities, they were actually able to find positive bovis within culture positive from the cheese, the fresh cheese, queso fresca, that were in the market. And again, in Ethiopia, we have several projects going on. And part of it, again, is that they don't have a national prevention and control program. And there is consumption of raw meat as well as drinking of raw milk. And so we feel that this is a very increased area. We have projects with University of Gondar as well as Addis Ababa University. And then we have also traveled to China to kind of collect again with the human and the animal interface. And then in terms of trying to identify if there's potential for connection between the two, we went to the Shandong Human Province Hospital to test the human and collect the human isolate, and then to do the farms within this area. And then again, this project has been on hold due to COVID. We have the rapid diagnostic test, but just have not been able to implement it. We've been doing some of the testing here in OSU. And then this is Dr. Anzai from Brazil, who actually was a visiting scholar to the U.S. She's been looking at Mycobacterium bovis in the Santa Catarina region, and she brought DNA of these isolates and came here to learn whole genome sequencing, and has finished her PhD thesis and is working on that. So we actually have a project where we're trying to work with individuals who have Mycobacterium bovis isolates globally, and to a new project with University of Georgia where we can get the denatured DNA sent to us, and then we can send it to the USDA for molecular genotyping. So if there's anybody out there who is working on Mycobacterium bovis, please reach out to us. It has to be animal isolates at this time. So again, my summary is just that zoonotic tuberculosis is a major public health concern, and we really do have to use this One Health paradigm in terms of human, animal, and environment, with integration, between all these sectors in order to really come up with a strategy to improve control as well as treatment and prevention. So Mycobacterium bovis is a health risk, certainly with consumption of unpasteurized milk and raw meat, cheese, but also close association with these infected animals and even other reservoirs. We do need surveillance. We need improved surveillance, but as part of that surveillance, especially for developing countries, if we could have a better test, improved rapid diagnostic test that could be used in the field that's cost effective, that can really help with this process. And of course, we need to have community outreach, engagement, as well as education. So I also want to say we have to think about TB all the time. And this is coming to the close of my slide. And I want to say obrigada as well to everyone. So thank you so much. Try to share.